Hi guys, it's Jen and I am back. I am here and this is my niche to talk about the mostly psychiatric industry and the harms that their medications do indeed cause many, specifically SSRIs and benzodiazepines. And I've talked a lot in my other videos about how I got to where I am now, and we're definitely going to be going in a lighter direction about life after the damage begins to heal, if and when that's possible, and it often is. I'm a living example of how this can be done. But I did want to touch on something that I'm seeing a whole lot, and it absolutely happened to me before I understood about the injury that was caused via or directly correlated to the benzodiazepine: improper tapering, abrupt withdrawal. It's very, very serious business. I had myself tapered down very significantly. I talk about this a lot. There really isn't a lot of good help out there in terms of, providers that really understand. For the most part, from what I can see, and the psychiatric industry is the most guilty. Their solution, if you're calling because you're on benzodiazepines and you need a provider, their standard go-to, it does not matter how long you've been on them, what type of benzodiazepine, the dosages, anything. They want an 8-week taper off. Why they will build you up on SSRIs, despite the fact of having medical records right in front of them that clearly indicate that these SSRIs in most people actually cause the condition they purport to treat. So what happens though when it comes to ADD and ADHD? I know people are going to freak out. And this is just my personal opinion. I'm not saying it doesn't exist. I'm saying we didn't go to never hearing of it in the 60s and 70s to having the reported 100 million Americans, I want to say it was 60 million of them, being children that are being treated for A.D.D or A.D.D is mostly the diagnosis children get. Now, let me make my disclaimer. I'm not a medical professional. I've had a lot of experience in the 12-step recovery programs. I ran a women's group that eventually kind of tapered off into a group specifically for people on benzodiazepine. It's just one of those drugs you can totally abstain from, but you have to do it properly. You can't do a fast taper, and you certainly cannot abruptly stop them. You can see previous videos about a lawsuit that is pending. They haven't been served yet. They had a hiccup, really, that isn't going to work in their favor, in that they refuse to give me my patient records. Legally, they cannot do this. Now, once a lawsuit might be involved, there's a tiny loophole of your lawyer being able to get them, but they were requested long before that was an idea. They have not been served yet directly. So the HIPAA law clearly states they have 30 days to provide you directly with your medical records. They can ask for an extension. They have to get that from HIPAA, and they have to have a damn good reason. They don't just give it to them. If they were to ask for an extension, and the reason every doctor that I've ever had, when I've asked for records, they say the exact opposite of what the law clearly states under HIPAA. We can't give them directly to you. We have to have you sign off a consent for um, a new provider or your new provider. Well, number one, there may not be. Number two, it's just a bold, blatant lie that they tell you. My best guess, and we will soon find out, although I think they're doing a lot of correcting now as best they can, but I can guarantee you I kept better records than they did. Screenshots of all the texting app appointments and the iPhones. One of the new updates is you can just hit in the upper left hand corner and you can record. It will announce to the other party this message is being recorded. It works both ways. I always say they are. I don't know whether they actually are or not, but I'm getting off track here. I just see it to be a real issue with people that are on benzodiazepine. You have this brain injury, that this is a legitimate clinical diagnosis called BIND, benzodiazepine induced neurological disorder. It results in tapering off them too fast and abruptly cutting them off. Both of those things can actually be life threatening. It's the one drug you simply cannot just stop or stop too fast. That and alcohol has to be carefully, properly, and accurately medically supervised. I'm popped on here and other places because a lot of times, according to your insurance and your financial status, you're not going to get the appropriate care. Like I said, their go-to usually is, let's do an 8-week taper and fill you up with SSRIs. That's a red flag you need to look for if you're looking for a provider and they're going in that direction. Generally, they don't want to lose the monthly billing. So if you talk to them, and just say that that's way too quick for me, can we just leave it where it's at now? And me personally, and now the thousands of people that I have communicated with, that have emailed me, texted me, messaged me on social media apps, we're relying on each other. The benzodiazepine groups on Facebook. It would be remiss of me and incorrect to tell you not to follow medical advice. The issue with that is when it comes to benzodiazepines, it's very difficult, especially with psychiatrists. I'm not going to go off on a tangent on the one that I'm suing. And, but I will say this. It's a really good thing. They've virtually been untouchable for decades and decades, despite the science and despite knowing what these do. It really is about money at the risk and cost of your mental health, your physical health, and unfortunately at times your very life. But with benzodiazepine, let's just say you're on a taper, or for some reason your tapering program has been interrupted, or you need to find a new provider. Anyway, the symptoms of withdrawal will very often present as an attention deficit. I know I'm going to piss a lot of people off. I don't know that it's a thing. There are so many medical diagnoses that are slapped on us, and I am a big advocate for the fact that we are medicating normal. I'm especially concerned with the number of kids, and I'm especially concerned at the fact that it was suggested to me, before I understood what was happening to me. I was all over the place, very scattered, very forgetful, no matter how hard I tried to get into a routine and be organized, was almost impossible. That was a direct result of the benzodiazepine. Now, people around me, would say, you have ADD, you have ADD. I heard that all the time. Never heard it as a child. I actually heard it at one point in my 40s as, and this was from a psychiatrist, adult onset attention deficit. That there's no such animal. That's not in the DSM-5 anywhere. But anyhow, about 3 years ago, I want to say, yeah, it was about 2021 or 2022. I'm hearing this over and over again. Now, I was on the biggest taper to date. I started, I think it was like in 23 on 5 milligrams, and I'm down to 2, but that taper off of the 3 milligrams happened much too quickly, looking back at it. So yeah, it absolutely looks and presents by what is purported to be attention deficit. I just remember being a kid, and having a lot of cousins and a lot of kids around. Of course, I went to school, and some kids were just really, really more active and into things, maybe a little clumsy. All the normal stuff I saw in childhood, looking back at it as an adult, is what we're medicating our kids with now, with amphetamine. I went through a health crisis in the late 90s, where I was just on a very similar to chemotherapy type treatment, and it came in very helpful in terms of energy. I still had to work full time. I had a little boy to raise, and then 2. But other than that, for the past, I moved to Georgia in 2007. So the primary medications and the only medications I will deal with is tramadol. That is one. Another one, let's see, I'm going to say it was in the mid to late 90s. I was working for a group of doctors, and the reps were just loading boxes and boxes and boxes into these doctors' office. The doctors didn't know too much about it, and they usually asked us to avoid the reps. But sometimes they would literally get caught, in between patients, and the rep is right there. So this was really pushed and marketed as a very safe, non-opiate, non-opioid, non-addictive drug. 8 tablets a day, no problem. It was and is very effective for pain. But let's fast forward a good 10 years, and now we're in 2014. Oops, FDA, my bad. It seems we do have to classify these as an addictive opioid drug that needs to be handled by pain management. In that area, I think as far as pain management, I'm blessed. I think I have a very knowledgeable, good doctor, and they will not be part of my repertoire, which is the only controlled substances that it will take is that, and that is on a taper and the benzodiazepine. Now, I probably pop about 20 pills a day, and they all supplements. Also supplements that we happen to sell for some very reputable companies that you do indeed need a medical license to sell, which my husband has. So pure encapsulations, Metagenics standard process, including their Meta Herb line. But that isn't what any of these are about. I will put a link for our website at some point. So yeah, it's looking a lot like ADD. I'm all over the place. So I got a recommendation. I was getting the benzodiazepine from a psychiatrist. This was during COVID. I never met once. It was all done through the phone. And at one point, it got so ridiculous, he just out and out told me, you know, all right, if you don't want to take an SSRI, which I made it emphatically clear, and I had records of the damage it did in terms of like one attempt to self-delete and always feeling that way until I just flushed everything. I don't recommend that. Like in 2006, around that time, everything but the benzodiazepine. I'm obviously glad I didn't do that. So I got a recommendation for a doctor that he basically deals with addicts, narcotics. With they use Suboxone, and I think methadone is another one. But I wasn't there as an addict patient. I was looking into whether or not I had A.D.D. and if I should use something for it. Well, the first thing I found out, and I knew this from before, basically anyone deliberately seeking them, you just have to pop off a list of a few things. And if you're an adult, well, or the parent of a child, very far, far too easy to get. So anyway, they also took over the benzodiazepine, which was good. One less doctor. And they also like took it down another milligram. So that's how I got to 2, where I've stayed on for a good year or 2. And in August, I'll begin another micro tapering via liquid. And I will share that experience with you. So yes, instantly diagnosed with A.D.D. and offered Concerta. They asked me which I would prefer. They named the list of all the amphetamines, and then it came down to what my insurance would cover. And here's what I always try to make a distinction, whether it's a medical fact or my opinion. This is the medical fact from a board-certified psychiatrist, Dr. Yosef. You never, ever want to be on an amphetamine when you're taking a benzodiazepine, period. Excuse me. Excuse me. But especially if you're tapering. They don't go together. One of these things are not, they're the exact opposite effect. And I don't even want to think about the fight that was going on physiologically. But anyhow, that's what they did. And, it really did appear that I would have that if you want to go by the DM5 and all the psychiatric labels that they slap on us to medicate normal. It was the benzodiazepine and probably a way too fast tapering down to the 2. Made me very, very scattered. The Concerta really didn't help other than it gave me energy. I travel back and forth to Massachusetts sometimes. It was good for long drives. If I was working inside the house at my business, it was really, really good for that. And that was it. I would actually chuck them, or I would have more than half the bottle left over at the end of the month. So the one that's being sued, when I transferred over to them, only because they took insurance and the provider I was with didn't, I wanted to, it was 20 milligrams, and I wanted to do 10 in the morning and 10 in the afternoon. So yeah, we were gonna see about that the next appointment. It wasn't an increase in dosage. It was just a lower dosage at different times of the day because it seemed like it was wearing off, and I didn't need it and shouldn't have been prescribed it anyway. And the next appointment, now mind you, they've been prescribing benzodiazepine and Concerta consistently for 5 months. And this was just a split in the dosage. They were so out of touch with, and the notes and the records have to be so inaccurate. Obviously, why they literally refused. At one point, he was angry enough when I asked for him. I said, look, this isn't going to work. This is going to be a legal issue. Please prepare my records. Notify me of any charges. I am driving to the office Monday to pick them up. And he nastily said they'll be ready and waiting. And at the final appointment, all of a sudden, we can't do that. They can only be given to a provider. That's actually illegal. And just the opposite true. They cannot give that or release them to anybody without your consent. The reason I think they do that is because they're so inaccurate, and especially if they've messed up colossally as this one did. Sure, they don't want me to see what they would have another provider see. They're gonna lean it in a good light for themselves, and they just didn't keep accurate records. I mean, that's provable. I have shots of everything. So yeah, the next appointment came around. Now, mind you, like I said, that they've been prescribing this for 5 months straight. And she actually said word for word, verbatim, I talked to Dr. Warner, and we can't prescribe amphetamine with clonazepam. They, had kind of been doing it for 5 months. The provider before that, at my request and via mutual agreement, before I really figured out how to do this properly, meaning taper off the benzodiazepines. So that's how out of touch they were with their patients. Absolutely incredible. They told me more than once about the hundreds and hundreds of patients they treat. I'm thinking there's 40 or 50 providers. Went to their website, there are 6, and the overseeing doctor, Dr. Warner, only consults. He doesn't meet with patients, although he did, I will say, mistreat me to a point of getting themselves into a lot of hot water legally. But yeah, that's actually what they said. I don't know why I'm surprised. That this is what birthed this whole thing with YouTube and TikTok or any social media, is to really hopefully help. And I know it's been very therapeutic for me. Advocacy, self-advocacy, learning everything you possibly can, and really empathizing with the fact that, especially psychiatric care, unless you have buku money, and could be treated in another country somewhere by some esteemed expert, you're pretty much stuck in the system and kind of at their mercy. I would trust a stranger that I've never seen face to face on one of the Facebook benzodiazepine tapering programs before these doctors. This is just me. Like I said, I'm uncomfortable saying, follow your doctor's advice. That's how this whole thing got started. A lot of people are being harmed, especially in the psychiatric area, from following their doctor's advice. So I'm not saying you should follow me, but I am saying, like I said, I make the distinction on when it's my opinion and experience, and obviously this has led me to do a lot of research. So this science against these SSRIs, and especially benzodiazepine, has been known for a long time. The benzodiazepine dangers are also known clinically from notable, credible resources, and yet their first go-to, the first provider in both situations, let's do an 8-week taper and load you up with SSRIs. And then, of course, you get shamed because you don't want to do that, and you get labeled as resistant to treatment because you won't take the treatment. But they also don't want to lose that billing. So what they'll do when they realize you have no interest in their SSRIs, and that is actually deadly. And when you tell them that, do you realize 8 weeks could actually kill me? You know, they really, some of them really believe it. That's what they were taught. But this last provider, the first one, she was too young. And the school that's coming up is actually teaching this. You know, and I wish they had, the AMA had some kind of criteria where they had to go back. I mean, my husband's a chiropractor. Every single year, he has to be recertified. He has to pay for it because there's new information coming up all the time in every area of medicine. To the best of my knowledge, correct me if I'm wrong, they never have to go back and refresh. You know, but they always have access, better access sometimes as a doctor. You know, I'm sure my husband can get into much better resources with that license number than I could access. So that's what I wanted to put out there today. Putting aside my personal feelings about ADD and the reality of it, I certainly don't advocate for medicating our children. You know, if you have the situation, yeah, it's going to help. You know, I mean, it'll help anybody to kind of, you know, I see a lot of kids that are just stimulated by it. I notice it can have a very depressive effect when it starts wearing off. Now imagine what like a 6 or 7, 8, 9, 10, 11-year-old is feeling in between this. Well, guess what? They have a solution for that too. We'll throw in an SSRI in between all that. I actually know of one 11-year-old boy, the sweetest thing, is on, I don't even know the amphetamine for the A.D.D. And he was losing a lot of weight and depressed and having some behavioral problems, so they threw in Abilify. Please see Dr. Yosef's video regarding Abilify, and we're talking about an 11-year-old. So back to us and back to our niche of exchanging information. Guys, exchange it, please. But first, that was my point. I think benzodiazepine withdrawal is commonly misdiagnosed as ADHD. To take the two together is not good. Any ethical doctor would know that. Like I said with my own, they were literally prescribing that and then telling me they can't prescribe both at the same time, but call both of them in that month. Unbelievable. You know, this one just brought it to a peak. You know, maybe it was a gift in a very ugly package because it opened my eyes that I'm not alone here. I am not going to get the proper help. You know, even a medical doctor or the other doctor that I see, they're really, really good. You know, but the other doctor doesn't deal with benzodiazepine or psychiatric drugs or anything in that nature, and he's very good at what he does do. You know, but a lot of primaries are prescribing for people. If you're a woman, your OBGYN might prescribe them. You know, any specialty, especially in SSRI. So that's what I wanted to say. Don't mistake your withdrawal symptoms for ADD or ADD, and a stimulant medication, especially while tapering, but overall with a benzodiazepine is not a good idea. On that note, like I said, guys, in other videos, I'm not looking to go crazy popular here. This isn't about likes. On YouTube, however, I guess you need to have, somebody can correct me in the comments if I'm wrong, you need to have 100 subscribers. to be able to go live, which would be save a lot of time anyway. So please go ahead and hit that subscribe button. Give me a thumbs up. And that's all for today. Like I said, I am committed to this. I'll show up. If I'm not here, I'm either on TikTok or, you know, even if it's like a little short. I'm showing up for this every day because I'm hearing you. I'm hearing your comments, and I have always known I'm not alone. You know, I will do the legwork for you. I will do the research, and hopefully we'll all be doing it together. So give me a subscribe and a like, and I will see you guys probably tomorrow, but I won't go more than 2 days. Have a good one. Bye.